Hi, my name is Dr. Judith Joseph, and I'm a Child and Adolescent Psychiatry Fellow at the NYU Child Studies Center. Thank you for joining us for our Grand Rounds lecture series, where we get to talk with the experts in the field of child and adolescent psychiatry. Today we have the pleasure of having Dr. Mary Fristad, and she is a professor of psychiatry, psychology, and nutrition at The Ohio State University. Thank you for coming.
Absolutely. Glad to be here.
You gave an excellent talk about the non-pharmacological treatments for bipolar spectrum disorders, and you talked about some interesting treatments in terms of therapeutic measures. Can you tell us more about the therapies?
Sure. We think about medication as being the frontline treatment for kids with bipolar type 1. We really don't have treatment guidelines for the other parts of the bipolar spectrum disorder. That can include bipolar type 2, the little manias and full depressions, or some other conglomeration of manic and depressive symptoms, often at a lower intensity level. So we don't have treatment guidelines. We do know that regardless of where you are on spectrum, it's very beneficial to add psychotherapy in. These are very difficult disorders to deal with, and so it's important that children and families learn how to understand the symptoms and manage them effectively. We have some intriguing early data suggesting that omega-3 as well as a multi-nutrient complex can really provide some benefit for both the manic symptoms and depressive symptoms.
Tell us more about these different therapeutic treatments and what they have in common.
Really, the active ingredients start out with what we call psychoeducation, which means teaching parents and kids about the disorder and how to manage it. And then we move on to somewhat more standard kinds of therapy content, helping kids develop emotion regulation strategies, helping the families develop ways that they can, as a family, improve their communication and problem-solving skills. And we really use examples within our therapy around managing those difficult symptoms. We also work particularly on nonverbal communication. There's some really fascinating neuroscience data showing that kids with bipolar disorder misread cues. So if I'm out on the playground and I think those 4 kids are angry at me, I might go set up an encounter that will make each 4 of those kids angry with me, even if none of them were even thinking about me ahead of time. But I misread the cue, and in my mind, I was reacting to their provocation. When maybe the playground monitor says, I didn't see anything else happening, he started it all. Mm-hmm. But in my mind, they started it. So we work on nonverbal recognition also.
Mm-hmm. And there's a real power in naming the disorder.
Absolutely. So I like to think of Harry Potter and Lord Voldemort, and when you can say those words instead of he who must not be named, it takes some of his power away. So calling a thing, as Dumbledore says, call a thing by its proper name, it takes some of the strength out. And in addition to that, when kids and parents really understand that the symptoms do not define who that child is as a human being, and if they can go back to who is that child as a person, and then think about what are the symptoms getting in the way of that kid really shining through, then we can really develop strategies to manage the symptoms so that everybody can really interact with the child, not the symptoms.
We learned so much. Thank you for coming.
Pleasure to be here.